You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. He is the go-to dentist in Texas for dental implants. With us, and he's been on the program several times before. Most people know who he is, Dr. Rick Kline. Dr. Kline, welcome to the program.
Well, thank you for having me again, Randy.
All right.
It's great to see you.
Always a pleasure having you on the show. Now, for people that don't know your practice, like who's the typical patient these days that comes in for dental implants?
It's really three different types of patients.
Okay.
It's people that have lost their teeth. They're already in dentures. They're already in partials. They're wearing partials. Or due to decay, their teeth are failing. And one by one, these teeth are being lost. And the third type of patient is the patient with gum disease. The gums are shrinking, the bone is shrinking, the teeth are getting loose, and they're needing help. And the people with the bad gums, the shrinking bone, they know one thing. They're headed towards dentures, and they know they don't want that solution.
Well, that's why people go to you, right? They want like a brand new set of teeth back.
They want a different solution. You know, the other dentists are not giving them a solution for their problems, and they're wanting something better. They want to be whole again, and they find me in Smile, Texas because of that.
Okay, now what's changed? Like I had you on the program about 11 or 12 years ago.
Right.
It seems like 20 years ago. We were talking about that in the green room.
We were definitely younger, right?
Yeah. So, I mean, what's changed in that? I mean, why is it what used to take you like much longer, like half a year, now you can do it a couple of visits?
You know, Randy, really everything has changed. You know, I remember how skeptical you were when I first talked about the teeth by tonight procedure years ago. I've been doing that for 16 years now and have done literally, you know, thousands of those procedures over those years. But now it's even better. Modern technology has brought us some great advancements, and I can go start to finish in a very rapid amount of time now.
Like literally 3 visits, right? Yeah,
Three visits.
They meet you the first time, take some imaging, come back.
Absolutely.
And then the next day, so like literally if everything goes right, 3 days later, they have brand new teeth.
Final teeth, not just teeth that night, but their final teeth, you know, by 3 days later.
How it's normally done, correct me if I'm wrong, you go to one place that they, like the surgeon that does the surgery for implants. Then you go to another doctor that puts the teeth on top and somewhere else for the imaging. Then they send out to a lab. And as you say, you kind of hope that it fits. At your place, it's all right there. The lab's there, everything's there. That's kind of like your secret sauce to do it quickly.
It is. It's a purpose-built facility that can handle that whole, from start to finish, everything the patient needs right there at Smile, Texas.
Are there a lot of people in Texas, though, like with an upper or lower denture?
Randy, there are tens and tens of thousands. I mean, we could fill the Houston Texans stadium with people with dentures or partial dentures. We could, you know, there are tens and tens of thousands that are silently suffering with bad teeth. You just, you know.
Well, why aren't they all doing it then? Okay, so if what you're saying is true, why aren't all these denture wearers, the thousands and thousands, doing this?
Well,
What's your take?
Most people think that once they have a denture, I'm done. That they fall out of the system. They don't visit the dentist. They don't know the advances in technology. They don't know how much better, honestly, they don't know how much better their life could be if they just got some fixed teeth again and could eat the foods they want and talk without the teeth moving. And then there's another group that are the near dentures that have those removable partials that come in and out. Yeah. And the removable partials is this whole domino effect of the partial causes stress on their good teeth, and then they end up in a denture.
So they end up losing all their teeth.
They end up in a denture eventually.
Is that right?
Absolutely.
How old can you be to do this?
Well, just this year, our youngest patient is, she was in her early 20s.
Okay.
We did two patients in their 90s, one 93 years old.
Why would a 93-year-old want to do this?
You know, you have your teeth. You take eating for granted. You take speaking for granted. You know, he came to me with dentures. They were falling out of his mouth. He couldn't talk, he couldn't eat, he was losing weight, his health was declining. And he said to me, I don't care if I'm 93, I don't care if I live one more year. I want to, I want to enjoy the life I do have. At 93, we took him from dentures to actually we repaired his bones, rebuilt the bones at 93. I used some stem cell technology to help kind of, boost his own system up and help him heal really well. But we did implants in his upper and lower jaws, and he has fixed teeth now, and he's eating again. He's getting his
So they can kind of eat whatever
back.
they want?
Yeah, absolutely. The day of surgery, Randy, they can start eating again. That day.
Really?
That day.
So how do most of these people hear about you?
Well, a lot of people are referred by people we've already treated at Smile Texas. The other way is this show. I mean, we've done, 5 shows?
Probably
You've
over the
interviewed me
years.
5 times
Yeah.
over the years. And people see have seen this show multiple times. They feel like they know me, but many of them are still skeptical when they come in. Can this really be done?
Really? They're skeptical?
Absolutely. I remember the first time you interviewed me, you were very skeptical because your dad had gotten implants,
Yeah.
their traditional method. So when I, talk to you about, teeth by tonight, I don't think you'd believe me.
No. He switched actually to the permanent teeth that don't come in and out.
So he did. So
And you were one of the people that, got me to talk him into it.
Well, I'm happy you did it because, the snap in, snap out are just kind of like a glorified denture. Yes, they can eat better, but, we came into this world with fixed teeth, Randy, and most people want to have their teeth fixed back again in their jaws. They don't want to have to think about it. They want to be able to brush their teeth just like they did when their teeth were all healthy.
So they come into your practice and they say, what, Dr. Kline, are you sure I can do this?
All the time. Or they think they're the worst. They think they're the worst case I've ever seen, and they're very skeptical that they can be helped. And there's not much I haven't seen in doing this, for over a quarter century.
Now, when you say they don't eat, on the consult, they don't even know how good this is going to be. You get excited about it.
I get so excited because they don't know what they're going to look like at the end. They don't know the life changes that they're going to experience. I have a lot of people that, I remember one lady, she owns a construction business, and her teeth were so bad she didn't want to go into a business meeting. She didn't want to, pitch the job, and it was affecting her career. She wasn't getting the respect that she deserved. I mean, just a phenomenal business person, and she didn't know, but I knew how much her life was going to change by having the teeth replaced, and her being confident to be able to walk into a room and not ever have to think about her teeth, just to be herself.
Nice.
It's
we've had this discussion, and you've explained to me that people with bad teeth are kind of judged. Like in Hollywood, we were talking about Hollywood. In the movie, you want to make somebody look poor, what do? Give them bad teeth.
I think we're judged all the time. It's that first impression, and if that first impression is a bad one, and you're in a job interview, and one looks presentable and has nice teeth and has a great smile, or a smile at all, and the other one has bad teeth, I mean, which are you going to choose? Say their skills are the same.
Or at least one that's smiling, that looks happy.
Absolutely.
For sure.
It's the window to that person's,
And you say
personality.
people start dating again, or at least they tell you that this motivated them to start dating again. They even take selfies on Facebook, and they irritate all their friends.
They do all of those things. Start dating, change jobs, get promotions.
Do they tell you this? They come in and say, "Hey, Doc, you got to hear,"
They do. They usually say, "I could have never done this without you helping me."
That's nice.
And for me, I mean, it's exciting and it's fun to see these changes, to see them be able to enjoy their grandkids when before they were afraid to get down on the ground, and kids notice everything. Grandma, why are your teeth missing? Grandma, why is your breath bad? And
so these are some of the motivating factors that get them to finally do something.
It's usually something that creates this push, because everybody's afraid to come see me. I mean,
nobody likes the dentist, for sure.
Nobody likes the dentist, and that's really sad because it keeps people away. Most of it is fear. Fear of going to the dentist, fear of pain. We have 2 board-certified anesthesiologists on staff. When we do these procedures, that patient is as comfortable
So
as
it's
you
like
can ever
IV
be.
sedation. They're just relaxing.
Yeah, it's IV sedation. We give the patient little bits of medication, a little bit at a time. It's very, very safe.
They're still a little bit conscious, or they could talk to you?
Yeah, I can talk to them most of the time. If I need them to tip their chin up or turn left or right, they don't remember it. Well, I've had patients that have said, Doc, that they call the office and they thought they missed their appointment because they forgot that they had an appointment. I mean, the anesthesia was that good. It's just made it into a really positive experience.
Now isn't the only problem, though, that if you've been wearing a denture like 10 or 20 years, you don't have enough bone to do this? Like you can't get dental implants.
A lot of people commonly think that. There is almost no one that we cannot treat. If they don't have the bone.
So that's just not true then, categorically. I mean,
categorically, it's not true. We either rebuild the bone to make them a candidate for implants, but most of the time, the vast majority of the time, I can work with the bone they have.
Let's take a look at some of the photos.
Okay, absolutely.
We have time for a few of those.
Okay, can we?
That's a big book, by the way.
Oh, thanks. This patient's name is Kim, and she came to us with, she'd been suffering from gum disease. Gum disease is the bleeding gums and the receding gums. She had a hard time chewing her food. The teeth actually started to separate apart. The gum disease was so bad. And she knew she didn't want to become a denture wearer. She's too young to become a denture wearer. She didn't want the lifestyle.
As you say, any age is too young.
Any age really is too young. But especially, she's a good-looking lady.
Yeah.
I mean, you're not going to believe her after, Randy. She went elsewhere looking for solutions. And when she came to us, it made sense to her that just in a matter of one afternoon, we could clean all this bad disease up, place the dental implants in her current bone structure, and she would walk out with fixed, non-removable teeth without ever having to wear a denture.
Let's take a look at that after.
Pretty amazing, huh?
Yeah.
I don't think she could believe it when she saw the mirror the first time of her after. When we placed those, permanent, beautiful teeth, what it did to her face. I mean, she looks younger. Do you not agree?
I would agree. She looks younger.
I mean, she's beautiful. I mean, the cool thing we found out along the way when we were working with her is she was getting married not long after that.
Okay.
So now she's got a beautiful smile to walk down that aisle, to get those wedding photos.
Nice.
And her overall health even improved.
So
Her
she would have
skin
been
cleared
wearing a
out.
denture possibly if she didn't go to you.
I guarantee you, she would have been wearing a denture or something that she just didn't
Now those
want.
teeth, because they look real, right?
Right.
You have a machine, two machines. I mean, you have a full lab.
We do.
That make the teeth right there on
We do.
premises. Is that right?
Yeah, we have some really cool new technology. One of the things is facial recognition technology. It's called Face Hunter. And it's kind of like at the airport. They scan our faces and they know who we are and where we're going, right? And we use that technology to have the patient with us when we're designing their teeth. Then from that facial scan, so we had the patient with us. We had them smiling. We had their face left and right, and when they're relaxed in their lip position and where their nose is and where their eyes are. And that's a quantum leap.
What it allows you to make the teeth to fit their particular mouth.
We
their
design
particular
the
face.
teeth for them. It gives us the artistic ability to have them with us digitally while we're designing their teeth. And you can see the outcomes, but look at the after, Randy. This technology allows us to make a perfect smile for that person.
What do you mean?
Well, look at the front two teeth. Look at the front six teeth. They follow the lower lip line.
Okay.
We put little details into this that are soft and feminine, but we left the eye teeth or the cuspid teeth with a little point on them to give it that sexy edge.
Okay.
It's that fun,
Like youth,
sexy
like
look.
young.
Yeah, I mean, this is fun. So
That computer,
Yeah.
that's why the teeth in this after kind of perfectly proportioned to that lower lip.
They do. We use some of the technology from Pixar and Disney. We use these special, they're called Wacom boards that we sit there and by hand completely digitally design every little detail into that smile to give them these kind of amazing results.
Now, when they look at their mirror the first time,
Yeah.
do some of these people get choked up? And do your team, do they ever get choked up or have to fight it?
We do this every day, and it's still, we're still excited. We're excited on the day they get the final teeth. But yeah, a lot of people have been looking in that mirror for so long, and not liking who they saw, it's a tearful, emotional.
And this can be done in one afternoon.
In one afternoon.
We're going to take a quick break. We come back, and I know you have a stack of photos here. We're going to kind of zoom through those. And I want to hear a little bit about the dental implant process, what they could expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I was very self-conscious about my face being sunk in due to lack of teeth in the back. I was fearful of eating in front of other people. I'm now able to smile really big when I take the pictures with my grandson, Joshua. He's the love of my life, and smiling big with him makes all the difference.
Smile Texas is a very unique, purpose-built facility for the placement and restoration of dental implants. We offer some of the most advanced technology in CAT scans, surgical suite, anesthesiologist, and one of the most advanced dental laboratories in the country to produce our restorations right here at Smile Texas.
I really had a problem smiling big because of the vacancies in my mouth, and I didn't like to eat in front of people for fear that these partials that I had that weren't permanent and moved around a bit and shifted, that they might come loose while eating in front of other people. How I felt when they took out my temporaries and put my permanents in and handed me that mirror, I was very emotional because first of all, they were, of course, gorgeous, but I could tell when I smiled that my bite was perfect, that everything lined up, that I was going to be able to eat foods that I haven't been able to eat in a long time, that I had that smile that would bring me the confidence that I needed to feel good about myself again and feel confident when I speak to others. I like to smile. I like to look people in the eye when I speak to them. I don't want to cover my mouth when I speak. So it was life-changing. Come to Smile Texas. Their fears will be subsided when they're educated by the staff and explained what will happen. And then once they get this beautiful smile, they'll just thank their lucky stars that they came in, because I know I do every single day.
I had major problems with my teeth, so my gums were pretty much gone. My teeth were starting to go. After talking to Dr. Kline, and once we went through the procedure, I learned that I had a lot of bacteria growth in the bone. I get a lot of compliments on my teeth now, where before, and I went back and looked through my pictures because my dad and my wife and my kids all made this comment that I never smiled, and I went to prove them wrong. So I went back to look through all my pictures, and I realized that every single one of my pictures was this or this or something along these lines. And so now I don't do that anymore. So I get a lot of compliments. Everybody kind of, what's different? Did you lose weight? You get a lot of that. And what did you do different with your hair? Which I don't have that problem. So you get those kind of compliments, but I get them all the time on the teeth. From a personal standpoint, and as stupid as this sounds, when I take a bite out of something, to me, I still look at it every time because it's a perfectly round bite. And I can bite through just about anything. So apples, things I wouldn't eat before, it just tacos. It doesn't matter anything. You look at it and you're just it's a mental thing, but you're like, I did that. So I keep the smile on everywhere I go.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my guest, he says nobody should be wearing old-fashioned or loose dentures. We're talking about dental implants today. He has a very unique center. He is Houston's go-to implant dentist, the premier center, Dr. Rick Kline. Okay, Dr. Kline.
Thank you.
I mean, you really are kind of the premier center. I mean, nobody, at the level you're doing it with your own lab, with everything under one roof, you've caught attention from dentists around the world.
We have.
You say the reason you're able to do it so fast is because of this digital workflow.
Yes.
So what is dummy that down for us? I mean, what does that really mean?
Everybody else in the country, for the most part, is doing it the old-fashioned way that we've done, in dentistry for the last 100 years. With the digital improvements in digital technology and design and manufacturing, most people know what CAD/CAM machines are. They're machines that take a block and they mill out a dental appliance, and they're very precise. We tell the machine exactly what to do. So we use the technology to create these beautiful super strong restorations, and then we put a hand artistic human touch. Our technicians make these beautiful
Like
bites.
these gums are like hand painted?
Hand
Like the
painted
teeth-
on.
Really?
Yes, multiple layers. They are beautiful, and they are so much stronger than anything we've ever had before. And it's all digital now, and it can be done very quickly. So, people that didn't want to, spend the 8, 9, 10 months the way most people are conventionally doing this, we can do this very quickly in a short period of time and do it, honestly better than the old-fashioned way that we've been doing.
Okay,
for the
good.
last
So
100
this guy
years.
right here, I'm looking at him
Yeah.
from a distance. I mean, it does change your appearance. Going into this, I always think Dr. Kline is exaggerating a little bit, but it does. It changes their whole look.
John's problem was decay. Bad enamel. Bad genetics. Mom or dad, grandma or grandpa. That gene gets passed down, and they've got bad enamel. With the bad enamel, he really lost 20 years of his life. One tooth at a time. He become more and more withdrawn over time.
So he lost 20 years of not smiling.
I'm
Is that
not
what you're talking
smiling.
about?
He's
Okay.
embarrassed to smile. You start growing a mustache and a beard, and at least guys do, to try to cover these things. But you slowly start to withdraw from society. And that happened with John. Part of John's problems too, he was taking some medications that gave him dry mouth. And that at the end kind of really, accelerated everything. But it led him to us. The turnaround we did for John was, in a matter of hours in a morning, we changed his life. We got out the bad teeth, we got the infections out of gums and the bones, we placed dental implants, and put a beautiful set of teeth on
Look at him. I mean, he's
John.
looking pretty good.
Do you not agree? Does he look younger? Does he look
He does,
smarter?
yeah.
I
Yeah.
mean, I knew
Like more sophisticated, actually. too.
definitely more sophisticated, but it was a confidence thing. I knew when he came in, we were talking earlier, I knew, and I told him, I said, John, I'm gonna change your life. And he didn't believe me, of course. And it was cool because after that, he sent us a little note that said, I didn't really believe Dr. Kline when he said he's gonna change my life, but I'm so happy that I trusted him to allow me, and it's an honor to help somebody like this. And he moved out west. It really started a whole new life, to put his old life behind him and really started a new life for himself. And he's so much more confident and he's so much more happy.
So the teeth did all that for him.
Yeah,
Just the teeth.
I know you don't think teeth are much, but if you don't like something about yourself, change it.
It does hold you back a little bit.
It's
That's
a
a good
big
point.
thing to him. It does hold you back, and it is important.
So who does this more? More women or more men?
Well, Randy, the first 10 years I did this, it was mostly women coming to see me. And if there were men, it was because the women drugged them to see me.
Okay.
But that's really changed. In the last 15 years, it's gotten to be almost 50-50. Men are starting to take better care of themselves. And it used to be that the men would come in and say, Doc, I just want to be able to chew. At the end of this, I just want to be able to chew. And that's kind of progressed into, Doc, yeah, I want to be able to chew, but I really want to look good again, too.
Okay.
And men are really getting into this as much as women.
Okay.
Look at this woman.
All right.
This is like a non-surgical facelift. Kim came in to see us. It was one of that cascade of events. One tooth after another started, deserting her, giving up on her. And so what she wanted was a brand new set of teeth.
Okay.
And with the teeth by tonight procedure, we're able to do that in a matter of a day.
So she was headed to dentures.
She was totally
Really?
headed dentures.
She
Yes.
looks good. Looks young.
She looks great. It's like almost getting a non-surgical facelift. When we put the teeth back where they're supposed to be, it helps support the
That looks
face.
really good. Very natural.
thank you.
So you made those teeth in your in-house lab.
We did. She, through the mock-ups, with the digital design and digital technology, we, in a very short period of time, were able to give her a beautiful set of teeth that she could do all the things she wanted to do again in life. That she could play with her grandkids, that she could smile without covering her mouth, and eat the foods that she's always, the raw vegetables,
So they can eat whatever they want.
Yeah, they can eat whatever they want, but patients tend to go on these soft diets that are really, really not healthy.
When you have bad teeth.
When you
Or
have bad
denture.
teeth, when you can't, when when you go to a restaurant and you're looking at what can I still eat, that's a problem. And a lot of these people won't eat when they go to the restaurant. They don't eat when they go to the family reunion. I hate to say
They
this.
don't like eating in front of people?
They don't like eating in front of people because they're so uncomfortable.
Okay.
And not confident in eating, but it really affects her overall health. Now she can eat anything she wants. She can smile freely. You get the personality. The sparkle comes back into their eyes, and it's amazing, Randy. It truly is
you
amazing.
love this.
Randy, I've been doing
we
this.
are completely out of time. We probably have 45 seconds, but you really do love this.
I enjoy it every day. I get up excited every day to go to the office and help people.
Now, we should mention that Medicare does not cover this. Even the best dental insurance doesn't cover the cost of dental implants.
No, it's an elective procedure. Nobody ever plans on being in these situations. But, most people use some kind of financing and things like that every single day.
So you have lenders that you use for dental finance?
We do. We have multiple lenders.
Do they finance it?
Yeah, a lot of people do. They need
Like
some
half
help.
of the people are financing this?
Probably about half.
Good.
And we have people at the office that help facilitate that and help them, make sure they can get the financing help that they need. But, they know they've reached the end of the line. They know they need the help. They know their life is not going to be put back together until they get these problems solved. And, I invite people to come on in. We do a complimentary consultation. Included with that, we do a complimentary CAT scan, so I can evaluate their bone structure and make sure.
How soon could you tell them on that first appointment whether you can do it?
That day.
And could you tell them, like, in 3 days from now, you're going to have a brand new set of teeth?
Absolutely. Yeah, I mean, I'm able to, with very careful pre-planning, we pre-plan the case, and then they come in, we're ready for the day of surgery, and then after that, shortly after that, we can put the final set of teeth in.
And you have like more than 25 dentists that send you their implant procedures.
We do.
Is that right?
do. Our laboratory makes beautiful full arch teeth for dentists from all around the country now. And we're really enjoying that, and they're enjoying having, working with an experienced laboratory, and I oversee those cases and communicate with those doctors, and it's been a lot of fun helping the other doctors deliver great, restorations for the patients.
So this is like your third set of teeth?
It's a new third set of chance. It's a second chance of having some really nice teeth again for these people.
All right, well, thank you for coming on the show. Always a
Thank
pleasure,
you.
Dr. Kline.
Appreciate it.
You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.